and welcome to Diabetes Connections in the News. I'm Stacey Sims, and these are the top diabetes stories and headlines happening now. In the News is brought to you by Athletic Greens. AG1 by Athletic Greens is daily nutrition made really simple. Our top story this week, if you've got an Abbott Libre reader, check it for a huge recall. The company is issuing a Class 1, that is the most serious, recall of all readers distributed in the U.S. from November 2017 to February 2023. It's more than 4 million devices. This is due to potential overheating, sparking, or fire that can occur when the readers are charged with non-Abbott adapters or when they are damaged or exposed to liquids. Abbott has reported 206 incidents, including at least 7 fires, 1 injury, no deaths. I've got the phone number to call and more information in the show notes at diabetes-connections.com. This recall only applies to those using the external reader device, not if you are using your smartphone. A big policy change coming in just a couple of days. The Centers for Medicare and Medicaid Services will expand continuous glucose monitoring coverage to more people with type 2. That starts April 16th, this Sunday, if you're listening as the episode first drops. The expanded coverage applies to people using a basal-only routine, as well as others who have had a history of what's been classified as problematic hypoglycemia. It's already covering people who use basal and bolus insulin. Bottom line, for those with type 2, check with your doctor to see if a CGM is now covered. Montana lawmakers are considering a bill that would require insurance companies to cover CGMs for people with type 1 and type 2. This has broad support from lawmakers, a lot of opposition from insurance companies and some providers. Mostly focuses on the cost, whether a CGM is medically necessary, and the possibility that CGM makers could raise their price if there is an insurance mandate. Blue Cross and Blue Shield of Montana, the state's largest insurer, says it's going to cost them nearly $5 million a year. The spokesperson also says, quote, "These things are a convenience." Short-term use of nonsteroidal anti-inflammatory drugs, NSAIDs, associated with an increased risk for heart failure hospitalization among people with type 2. This is a Danish registry study. It was a very big one, though. 300,000 patients with type 2. Short-term use of NSAIDs associated with a relative 43% increased risk of a first-time heart failure hospitalization in the next month. 78% for people with type 2 over the age of 80. It's important to keep in mind, though, heart failure was not associated with using NSAIDs in people with well-controlled diabetes and normal blood sugar levels. By the way, some common NSAIDs are aspirin or ibuprofen or naproxen. Acetaminophen, Tylenol, is not an NSAID, but definitely check with your doctor before using any of these. New study from Boston Children's Hospital shows more care is needed for that transitional time between childhood and young adulthood in people with type 1. They found routine outpatient care decreases between ages 16 and 24. At the same time, emergency room visits to treat type 1 go up for that age group. The study raises concern that young adults lack a, quote, medical home with an endocrinologist and may instead be seeking routine care from the emergency department. These researchers hope the study can serve as a launching point for endocrinologists to assess how they can help young adults better manage type 1. A new review article in The Lancet says that only 21% of adults with type 1 have an A1C of 7.0 or lower. They used information from the T1D Exchange to come to that conclusion. They also say that there should be greater awareness of adult onset of type 1, saying that up to 40% of T1D diagnosis occurs in people over the age of 30. Racial and ethnic disparities persist. Insulin pump usage is lowest at 18% among Black populations, 40% among Hispanic populations, and 72% among non-Hispanic white people. The paper also reports inhaled insulin, brand named Afrezza, has demonstrated a fast onset of action, improving the ability to control glucose after meals. Some good news for people with type 2. University of Michigan Health Department followed more than 120 people who had bariatric surgery for obesity. They found that all metabolic risk factors for developing diabetes improved. Particularly, they saw improvements in peripheral neuropathy, a condition marked by damage to the nerves. Obesity is the second leading risk factor for peripheral neuropathy after diabetes. Right back to the news in just a moment. But first, let me tell you about Athletic Greens. I first heard about AG1 from Athletic Greens on another podcast. It was a business and tech podcast. It had nothing to do with diabetes or health, but the host was saying that, every time she has a smoothie, she mixes in Athletic Greens. And I thought, that sounds pretty easy. So I gave it a try. I wanted what she was talking about, immune system support, increased energy. I wanted a supplement that actually tastes good. And I wanted everything in one place, multivitamins, minerals, pre and probiotics. My husband Slade will mix it in water. Lots of people do that. I am definitely a fan of mixing it into a smoothie. I like that AG1 is delivered monthly. I don't have to think about it at all. You can get travel packs so you don't have to miss a day. If you want to take ownership of your health, today's a good time to start. Athletic Greens is giving you a free 1-year supply of vitamin D and 5 free travel packs with your first purchase. Go to athleticgreens.com/Stacey. That's athleticgreens.com/STACEY to learn more. Interesting clinical trial starting. A drug called CPP-1XT has been shown to help treat pancreatic cancer, and it's being evaluated for the treatment of type 1 diabetes. This is a company called Panbela Therapeutics, which acquired Cancer Prevention Pharmaceuticals, a clinical stage biopharmaceutical company that focuses on developing therapies to prevent cancer and rare disease. This study will involve enrolling 70 patients across 6 different centers, with Indiana University leading the trial. The first patient has been enrolled. Some additional news I'd love for you to check out. Thrive Abedes is back. Thrive Abedes is a conference for people living with type 1 and the people who love them, and aims to bring people with diabetes together to share experiences. It is happening in Dublin, Saturday, May 6th, and they haven't had this conference since before COVID. It has been quite a while since this group has gotten together. They are super excited about it. I'm speaking at this conference, and man, am I excited about that. If you're anywhere nearby, I know we are a US-centric podcast, but we have many, many listeners in the UK. I see you in Ireland. I can tell you're downloading. So please check it out. I'll put a link in the show notes so you can learn more and join me at Thrive Abedes. Also want to let you know that really excited about this. The World's Worst Diabetes Mom series, that's the World's Worst Diabetes Mom and still the World's Worst Diabetes Mom, have each won the Mom's Choice Gold Award. This is a really cool award for family-friendly products. It's a big seal of approval. I was excited. I thought the first one might get it, but when they both got it, it was really cool. Also, letting you know that the second book is now out on Audible. It is an audio book exclusively on Audible. You can get that through Amazon. I do have a contest that's been going on all this week on Facebook and on Instagram and through the newsletter. The contest closes Saturday, April 15th. So if you're listening to this episode as it drops, you've still got some time to enter, so check that out. But you can always find the books at diabetes-connections.com. That'll link you to either buying them through me or through Amazon if that's easier. Whatever makes it easier for you is fine with me. On the podcast next week, Giselle Parra was diagnosed as a teenager, and it couldn't have gone worse. They didn't even prescribe insulin initially. She was totally misdiagnosed, and she struggled with getting the right diagnosis and with her mental health. But now, many years later, she has children of her own, and she makes medical jewelry and tags with her company, A Tad Too Sweet. I'm excited for you to hear her story. Last week on the show, you heard from Dr. Bryce Nelson all about Tzield, which used to be called teplizumab. He's one of the first doctors in the U.S. to administer it after its FDA approval. It was really great to talk to him. If you haven't heard it, you can find that episode wherever you're listening to this one. And that is it for In the News this week. If you like it, please share it. Thank you so much for joining me. I'm Stacey Sims, and I'll see you back here soon.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.